Hello everyone, I am Dr. Rohit Solanki. Welcome in my YouTube channel Radio with Rohit. Today we are going to discuss one very interesting topic, lymph node level in neck. First question is that what is the purpose to learn the level of lymph nodes in neck? It helps in the diagnosis of any malignancy, infection and mets. Clinical relevance is in the oncology and staging of cancers of the neck. Brief anatomy of the cervical lymphatic system help in us in radiological and anatomical aspect of neck. So first of all, we will discuss the anatomy of the neck in brief. This is our mandible. This is mastoid bone. This is hyoid bone. This is cricoid. This is sternum. This is clavicle. Repeat. This is our mandible, mastoid, hyoid bone, cricoid, clavicle, sternum. This is the imaginary midline. This is our trapezius muscle. So, this is our neck space entirely lined by the imaginary midline, inferiorly by the clavicle, posteriorly by the trapezius, and superiorly by the mastoid and imaginary line joining mastoid to the mandible and inferior ramus of the mandible. This neck space is divided in anterior and posterior triangle with the help of one muscle, sternocleidomastoid. This is our sternocleidomastoid muscle. Further, this triangle are divided into smaller triangle like anterior value of the digastric, and this is the posterior value of the digastric. So, this small triangle between the anterior value of the digastric and anterior imaging line is called a submental triangle. This is the anterior value of the digastric. This is the posterior value of the digastric. Superiorly ramus of the mandible. This is called a submandibular triangle. This is our superior value of the omohyoid. This is the inferior value of the omohyoid. Space in between the superior value of the omohyoid and sternocleidomastoid lower one-third part and anterior imaginary line. This is called a muscular triangle. Triangle or space in between the posterior value of the digastric, superior and medial part of the sternocleidomastoid. This space, which is here lined by the knuckle fold, is termed as the carotid space. So this complete space is called as anterior triangle of the neck. So anterior triangle of neck has one submental space, submandibular space, muscular space, and one carotid space. Now we will discuss the posterior triangle of neck. Posterior triangle of neck is lined by anteriorly by the sternocleidomastoid, posteriorly by the trapezius muscle, inferiorly by the clavicle. This inferior value of the omohyoid divides this posterior triangle into the two parts. Superior one, which is outlined by the trapezius muscle, inferior value of the omohyoid, and the superior or middle part of the sternocleidomastoid. This triangle is called as the occipital triangle. Another space which is outlined by the inferior part of the sternocleidomastoid, inferior value of the omohyoid, and the clavicle. This is the supraclavicular triangle. So once more we will revise the triangles of neck: anterior imaginary line, hyoid, and anterior value of the digastric form the submental triangle. Anterior value of the digastric, posterior value of the digastric, and the ramus of mandible, this form the submandibular triangle. Imaginary line, inferior part of the sternocleidomastoid, superior value of the omohyoid form the muscular triangle. Superior value of the omohyoid and medial and superior part of the sternocleidomastoid, these form the carotid triangle. So submental, submandibular, carotid, and the muscular triangle, these form our anterior triangle of the neck. This sternocleidomastoid, trapezius, and the clavicle form the posterior triangle, which is divided by the omohyoid. Space in between the superior and medial part of the sternocleidomastoid, trapezius, and inferior value of the omohyoid is called as occipital triangle, and space in between lower part of the sternocleidomastoid, clavicle, and inferior value of the omohyoid form the supraclavicular triangle. So after discussing the brief triangles of the neck, now we will discuss. Here also we can see that this is the anterior value of the digastric, this is the posterior value of the digastric, this is the sternocleidomastoid, superior value of the omohyoid, inferior value of the omohyoid, and this is our trapezius muscle. So this is our submental triangle, submandibular triangle, carotid, muscular, occipital, and supraclavicular triangle. So this is our posterior triangle, and this is anterior triangle of neck. Here also we can see that this is the sternocleidomastoid, this is the posterior triangle of the neck, this is the anterior digastric, posterior digastric omohyoid, and this is the anterior triangle of the neck. So our final conclusion or here is the list of the level of the lymph node. First of all, we will discuss what are the level and where this level help us. So first of all, this is the imaginary line. This is the anterior value of the digastric forming the submental space. The submental space lymph nodes are given the name A1 or 1A. This is submental space anterior value of the digastric, posterior value of the digastric, and ramus. This is 1B. So 1A is the submental space, 1B is the submandibular space. Now, if we will draw one line to the inferior to the hyoid bone, one line to the inferior to the cricoid cartilage, and divide these sternocleidomastoid levels into the three parts, one upper to the inferior line to the hyoid bone, and one in between the line to the hyoid and inferior part of the cricoid, and one below this line to the cricoid cartilage. So this space is termed as level 2, level 3, and level 4. Further, these levels are divided on the basis of the location to the jugular vein. So this spaces are also, this level are also termed as upper jugular, middle jugular, and the lower jugular level. Upper jugular further divided into the level which is anterior to the jugular vein to the level 1A, and posterior to the jugular vein level 2B. This is the anterior jugular upper level and posterior jugular upper level. One is in between these two lines, hyoid and cricoid, is level 3, also called as mid-jugular level. 4 is lower jugular level, which is further divided into 4A and 4B. 4A is our lower jugular and 4B is medial supraclavicular level. So we will revise it. Submental is 1A, submandibular is 1B, anterior jugular upper level 2A, and posterior jugular upper level 2B, mid jugular 3, 4A is lower jugular, and 4B is medial supraclavicular level. Now, 5A and 5B are the level in our posterior or triangle. So, 5A is up above to this imaginary line and 5B is below to this imaginary line. This is the upper posterior triangle and lower posterior triangle. 5C is lateral supraclavicular level. 1A is our submental, 1B is submandibular, 2A anterior jugular upper level, posterior jugular upper level 2B, 3 is the mid jugular level, 4A is lower jugular, 4B is the medial supraclavicular. 5A is our upper posterior triangle, 5B is lower posterior triangle, and 5C is lateral supraclavicular. Now we'll further move to this anterior triangle, which is given name level 6. Level 7A is a retropharyngeal. We will discuss it level later. Level 7B is retrosteroid. This is our space to the parotid gland, and the lymph node level of the parotid gland are given the name or the level 8. 9A or 9 is buccal facial level. 10A is the retroauricular and 10B is occipital. Finally, we will discuss it as a submental 1A, submandibular 1B, 2A is anterior jugular, 2B is posterior jugular upper level, 3 mid-jugular, 4A lower jugular, 4B medial supraclavicular, 5A upper posterior triangle, 5B lower posterior triangle, 5C lateral supraclavicular, 6 is anterior triangle or anterior cervical, 7 is retropharyngeal and retrosteroid, 8 is our parotid gland, 9 is our buccal facial, 10A 10 is divided into 2 retroauricular and occipital. Now we will discuss the importance of each level. Before that we will discuss that this is our jugular vein. Anterior to the jugular vein is 2A, 2B, 3A, 4. Rest we have discussed in previous slide. So here this is our CT scan at the level. Here we can see that this is the sternocleidomastoid. So we have already discussed that sternocleidomastoid is dividing the triangle into anterior and posterior. This is our level 2A, this is our level 2B. This is the posterior line to the internal jugular vein. So anterior to the internal jugular vein is level 2A, posterior to the internal jugular vein is level 2B. This is our parotid space, this is given the level 8. This is our submandibular level 1B. This is our pharynx and this is the retropharyngeal or parapharyngeal space giving the level 7A. This is buccofacial space giving the name 9. So this is our occipital space given the name 10B. Again we are seeing here this is the posterior border of the internal jugular vein. So anterior to the internal jugular vein is level 2A and this is level 2B. Here also we can see that this is a sternocleidomastoid muscle and this is the level 6A, or also we can say that anterior cervical level. This is level 5A, posterior cervical level. This is sternocleidomastoid and this is the level 3. Further, here we can see that this is our trapezius muscle posteriorly. This is our sternocleidomastoid muscle. So level at mid, this is the 5B. This is the 4A level. Here we can see that this is the 4A level. This is the 6A anterior cervical level. So sternocleidomastoid, this is its anterior border. This is posterior border. Posterior border and posterior trapezius here is 5B. So also here we can see that this is the stelloid level and this is the retrostelloid. So somewhere here is the stelloid, retrostelloid. So here at the end we are discussing that this is the 1A submental, 1B submandibular, anterior jugular, posterior jugular 2 and 2B, 3 is mid jugular, 4A is lower jugular, 4B is the anterior supraclavicular, 5A is the upper posterior triangle, 5B is the upper post 4A, 5A is the upper posterior triangle, 5B is the lower posterior triangle, 5C is the lateral supraclavicular, 6 is the anterior cervical, 7 is the pharyngeal, 8 is our parotid, 9 is buccopharyngeal and 10 is joined to 2 retroauricular and occipital. Thank you for watching this video. I am Dr. Rohit Solanki.